Hey everyone, it's Dr. Rao here, and today we're diving deep into a topic that's close to my heart, antimicrobial resistance, or AMR, in the ICU. Now, as many of you know, the ICU is a place where we treat the sickest of the sick, patients battling for their lives, and when it comes to fighting infections, time is critical. We often rely heavily on antibiotics to keep these infections at bay. However, the overuse and misuse of these life-saving drugs have led to a growing crisis: antimicrobial resistance. In this video, we'll explore the factors fueling AMR in the ICU, the challenges we face, and most importantly, what we can do to combat this silent pandemic brewing within our critical care units. Let's get started. Imagine a patient rushed into the ICU, critically ill, with suspected sepsis. Time is of the essence, and we need to act fast. In such situations, we often start broad-spectrum antibiotics, even before confirming the infection source. This approach, while sometimes life-saving, comes with a downside. The frequent and often unnecessary use of broad-spectrum antibiotics creates immense pressure on bacteria, leading to the survival and proliferation of resistant strains. This vicious cycle of overuse and resistance development is a major driver of AMR in the ICU setting. The ICU environment itself can make patients more vulnerable to infections. Many patients are immunocompromised due to their critical illnesses, medications, or underlying health conditions. Add to that comorbidities such as diabetes, kidney failure, and cancer, which are prevalent in ICU patients, further weaken the immune system. This perfect storm of compromised immunity and exposure to resistant pathogens creates a fertile ground for difficult to treat infections. The ICU is also a breeding ground for hospital-acquired infections, or HAIs. These infections, often associated with medical devices like ventilators, catheters, and central lines, pose a significant threat. Think about infections like ventilator-associated pneumonia, catheter-associated urinary tract infections, bloodstream infections, and sepsis. These are not just fancy medical terms. They are serious and potentially deadly infections, and they are increasingly caused by multi-drug resistant organisms. Now, let's talk about biofilms. These are like fortresses that bacteria build on surfaces, such as those medical devices we just discussed. Imagine a city encased in a protective shield, making it almost impenetrable. That's what biofilms do for bacteria. They shield them from antibiotics and our own immune system, making infections incredibly stubborn and difficult to treat. This is yet another challenge we face in the fight against AMR in critical care. As resistance grows, our arsenal of effective antibiotics shrinks. We are increasingly forced to rely on last resort antibiotics, drugs like colistin or tigecycline, which often come with significant side effects. And to make matters worse, the pipeline for new antibiotics is running dry. Pharmaceutical companies face economic challenges in developing new drugs, leaving us with fewer options to combat these evolving superbugs. This is a sobering reality we face in the ICU. The rise of AMR in the ICU is a critical challenge, but it's not an insurmountable one. We need a multifaceted approach, a collaborative effort to combat this threat. Stringent antibiotic stewardship programs are crucial to ensure we use these life-saving drugs judiciously. Rapid diagnostic tools can help us identify the culprit pathogens quickly and guide targeted treatment. And of course, we desperately need innovation in the development of novel antibiotics and alternative therapies. The future of critical care medicine depends on our ability to tackle AMR head-on. We need to act now, together, to preserve the efficacy of these essential medications and protect the lives of our most vulnerable patients.